Well, people across social media have been writing into us to know more about Covishield and about the vaccination process itself, the drugs, how it actually works, the gap between vaccinations. So we've got the best person there is to talk really about Covishield from a medical standpoint. Dr. Suresh Jadhav is Executive Director here at the Serum Institute of India and joins us. Thank you very much for speaking to us. So, a couple of quick questions which people have been writing into us. First question, protection levels after the first dose, what would they be? And the ideal gap between the first and second dose should be what?
I think the protection level after the first dose, which we have seen in the clinical trials, which was carried out at 4 different countries, are varying from are varying from about 50.4% to almost about 90%.
All right.
Yes.
And if you get a first dose, right, and a lot of people are asking this, is it okay to not take the second dose?
No, I will definitely suggest to take the second dose, because then if you have only got half the protection, that means half people have not got the protection. So there is a better chance for them to get substantial protection after taking the second dose.
And the efficacy doesn't work with one dose.
No,
I mean, so
no,
the
correct.
science doesn't
Yeah,
work.
science doesn't work that way.
Thirdly, if you are already, if you had COVID-19, should you still get vaccinated?
Yes, of course, you can and you should get vaccinated, because there have been, I think, at least half a dozen cases where the people have got COVID twice. So I think my suggestion is that even if you have a COVID and you have recovered, you must take the COVID vaccine.
Okay. Next question. And the question is this. After getting vaccinated, can you still catch coronavirus?
Yes, very good question. And the answer is yes, you can catch the COVID virus. That happens with all the vaccines and for all the diseases, that even if you are vaccinated, you can get the disease. But the difference is you can get the infection, but you will not get the disease.
Okay.
Yeah.
All right.
So, and even if you get a disease, it will be very mild, maybe asymptomatic,
Right.
or symptoms will last only for a day or two, and you will recover completely.
Okay.
Yeah.
Final question for our social media users. Are 2 doses from different vaccines okay?
In my opinion, no, because I think the technology which is used for making the vaccine is different. The way these vaccine act in the body is also different. Therefore, if you start with one particular brand, you should take the second of the same brand. You should not mix up 2 different vaccines at this time. And as such, there have been no studies so far using 2 different brands and putting them together.
All right, Dr. Jadhav. That's a quick set of questions for our social media users. Lots of people have been writing into us. So you got some basic questions in, and we hope you've got some straight answers.